And is it true that PAH is often diagnosed late?
Absolutely. Most patients, unfortunately, aren't diagnosed until the disease is pretty advanced.
What's one word to describe the global state of PAH awareness?
I would say lagging.
Should all patients with unexplained dyspnea be evaluated for PAH?
They certainly should be screened.
Hello and welcome to the ENJ podcast with me, your host, Dr. Saranya Ravindran. This is the second episode in our mini-series on rare lung diseases, and today we're turning our attention to pulmonary arterial hypertension, or PAH, a complex and progressive condition that remains under-recognized despite its severe impact on patient lives. I'm thrilled to be joined today by Dr. Neal Chaisson, Assistant Professor of Medicine and Program Director of the Critical Care Medicine Fellowship in the Respiratory Institute at Cleveland Clinic. His clinical and research focus lies in the evaluation and treatment of PAH, and he also plays a pivotal role in medical education, particularly in the Pulmonary Vascular Disease Program. Dr. Chaisson, welcome. It's a pleasure to have you here.
Thanks, Saranya, for having me. It's a pleasure to be on your podcast today.
So we're going to begin with some quick fire questions. So please answer them as briefly and as quickly as you can. Let's go. What's the most common misconception about PAH?
The most common misconception is that pulmonary hypertension therapies, specifically vasodilators, can treat all causes of pulmonary hypertension. And unfortunately, those medicines are really indicated for a small percentage of patients with group 1 PAH, even though that doesn't represent the majority of patients with elevated pulmonary pressures.
And how rare is PAH truly?
The literature reports that this disease for group 1 pulmonary arterial hypertension affects about 15 to 50 cases per million people. It's certainly rare, but frankly, it's often underdiagnosed in those patients for reasons we'll get into.
And is it true that PAH is often diagnosed late?
Absolutely. Most patients, unfortunately, aren't diagnosed until the disease is pretty advanced. There's several studies which have shown that the average time from symptom onset to diagnosis is at or greater than 2 years for most patients.
And what's one condition that PAH is most often mistaken for?
The most common conditions that patients report that they've previously been diagnosed with are asthma, obesity, deconditioning. And the reason for this is because of the shared symptom of breathlessness in all of these patients. And we'll talk a little bit more about that in this podcast.
What's one word to describe the global state of PAH awareness?
I would say lagging.
And what's the most exciting development in PAH research right now?
This is a wonderful time to be in the pulmonary hypertension space. There are therapies that are frankly disease modifying that are starting to emerge, and that's extremely exciting.
And if there's one thing every respiratory clinician should know about PAH, what is it?
If your patient has unexplained dyspnea and their lungs are otherwise normal, you need to start thinking about pulmonary hypertension and pulmonary arterial hypertension early in the diagnostic process.
Okay, so now for some yes or no questions. Can PAH be detected through echocardiography alone?
No, it can be screened for, but it cannot be diagnosed.
Should all patients with unexplained dyspnea be evaluated for PAH?
They certainly should be screened.
And is right heart catheterization still essential for diagnosis?
Absolutely, yes.
Can early diagnosis significantly improve the outcomes in PAH?
Yes, for sure.
And are we seeing progress towards disease-modifying treatments?
Fortunately, yes.
Great. Thank you very much.